I want to make you a dangerous test taker, right? A test taker that the NCLEX is going to be scared of, in a way that NCLEX will have no choice than to stop your exam in 85 questions. Right. Now, in order to achieve this, I need to walk you through three process. Right. Three-step process. Now, this process, I've been using it for the past 2 years in coaching. By the way, my name is Favour. I've been coaching for the past 2 years. I'm the founder of Future RNPN. You can find me here on YouTube, Future RNPN, and you can also find me on Instagram, Future RN_PN. Now, let me just put it on the screen. Instagram, Future RN_PN. Right, Future RN_PN. YouTube, it's just Future RNPN. Right, so I'm the founder. Now, I've been coaching for the past 2 years, right? In my first year of coaching, I helped 52 students to pass the NCLEX exam. Now, in my first year, I was trying to like see what is working, right? Because I just started, right? So the way I was helping a particular student, right, can be similar to the way I was helping another student, but there were a lot of things that were not the same, right? So my mentor told me this. My mentor said, right, this time around, I should put together all the clue, because she told me one thing. She said, success leaves clue. She said, now I can now see how I helped student A pass, how I helped student B pass, how I helped student C pass. Put all these clue together and use it to create what? A coaching program. Right. If you look at my screen right here, you can see this is my coaching platform. Right. When students pass, right, I tend to like remove them from the group. I only make sure that students that are taking the NCLEX exam are the one that are on the group. So currently right now, right, as of today, 25th June 2025, I have 49 students enrolled into my what coaching program, ready to pass the NCLEX exam in 85 questions. Right. Learning from this particular clue, same clue that I used to help a particular student who failed the NCLEX exam 14 times, right? And then she passed on her 15th attempt. Now, her 14th attempt, she failed in 85 questions. Guess what? On her 15th attempt with me, she passed in 86 questions, just one question. My goal is to make every student pass in 85 questions. Yes, but the truth is that most students can pass in 85 questions, and they can also pass in 150 questions. So it's either you pass in 85 questions or pass anywhere between 86 to 150 questions. It's not bad. But with my unique way of teaching, I believe every student have the ability to pass the exam in 85 questions. But if you don't pass in 85 questions, it's fine. Now, I have a particular student who passed in 92 questions, right? That is the highest in my coaching program. So far, so good in the last 2 years, right? This particular student who failed 14 times, right? Guess what? She passed in 86 questions. That's just one question from the goal, right? Because my goal is to make you pass the NCLEX exam in 85 questions with this way of seeing question in a way that NCLEX question is not difficult, right? There's no how NCLEX question can be difficult if you understand this three-step process I'm about to show you. We are going to use it on this question, and you are going to understand a lot about the way you need to start thinking like the examiner, right? So this is a unique approach. What is holding you back is these three things. One, content. Two, write. Three, understand. The moment you can have these three things in place, trust me, nothing is stopping you from passing the NCLEX exam. Now, the moment you understand your content, you know how the NCLEX write the question, and you can understand it, you end up gaining these three C's. I call it clarity, confidence. You when you see your NCLEX question, you gain what? Clarity, right? When you like understand the question, you are clarified about it. Now, automatically you become confident, and lastly, right, you feel certain about the answer that you are selecting. Now, this is how it works. Now, when a particular NCLEX student see their question and they don't understand what the question is asking, at the end of the day, they are not clarified, right? Because they don't understand the question. So now, when you don't understand the question, you don't have this. Now, immediately you lose what? Confidence in yourself. Am I making sense? Now, When you are not clarified about what the question is asking, you don't have confidence about what the question is testing, trust me, if you are going to select any answer, you are not going to be certain about the answer, right? So the moment we fix this, you are going to see every NCLEX question and it's not going to be challenging again. And I'm going to show you in this one question right here on the screen. Now, content. When I ask students, have you seen the NCLEX content before, right? Or have you studied content for the NCLEX exam? Every student will say yes. Now, when I ask them, where did you study the content from? They will say they studied it from what? A question bank program. Now, you can study content from question bank program, but the real question is, do you know the content yourself? Because it's just like right now. It's just like right now. Let us say I want you to pay a visit to me, and I say, okay, if you walk down the street, you are going to see a blue building. That is where I stay. Now, if you walk down the street and you don't see a blue building, you will be lost because what you will feel at that moment is that, oh, he said I will see a blue building, but I'm not seeing a blue building, so there's no how you can locate me. Right. So that is the same thing. Now, that is the same thing that happened when students go on the NCLEX exam. They use a particular question bank program, right? And they go on the NCLEX exam and it look like a different environment. Questions on the NCLEX exam now look like what you have not seen before. It become a big problem. But guess what? If initially you got used to the content yourself, and then you start comparing to see if truly each of your question bank program is testing that content that NCLEX want to test. That way you take control of your studying. You know question that you need not to waste your time on, and you know question that you need to pay attention to. Am I making sense? Because this is how you take control of your studying. Like, just like right now, it's just like now, if you have visited me before, right? Prior to maybe the main day I want you to visit me, you don't need to know the color of my house, right? Because you already know how to get to my house, right? So all you just need to just do is to come. Another way is to maybe get a Google map, right? Get my location, trace it through Google map, and you'll be able to come directly to my house. So this is not going to be a stress. You will not start figuring things out on the day of the exam when you know the content by yourself. So what you need currently now is to know the NCLEX content by yourself. The moment you know the NCLEX content by yourself, you are going to pass the exam. That is the one thing that is holding you back out of 3 different things. Now, the content is not enough. You now need to start learning how the NCLEX writes the question. Now, NCLEX write the question using 3 parts. The moment you can identify these 3 parts in your question, you are going to succeed. Remember I said, I'm going to make you a dangerous test taker, somebody that understands the question. In fact, this is what I want to do for you. I want you to go on the NCLEX exam and let every question look like a practice test. Am I making sense? Right? Is this what you want? Trust me, this is what you want. Now, because I've seen a lot of students are struggling. We are going to break this question. I'm going to show you. Now, the 3 parts is what we call the body, the stem, and then the answer keys. Right. The body of your question contain the content. Right. It's just like now. Let me break this down for you. When you are in nursing school, right, your lecturer want to give you a particular exam on med-surg. Right. At this point, you are worried, what will the exam test? There's a lot under med-surg, right? Now, if your examiner now tell you, okay, I want you to focus on hypertension, I want you to focus on diabetes, I want you to focus on COPD. Now, your anxiety level will drop a bit, because now, instead of thinking about studying the whole med-surg content, you only need to focus on what? Hypertension, diabetes, COPD. Am I making sense? Now, the next thing you are thinking about, right, is the past question. Now you now want to now say, okay, is there any past question that I can study, or is there any question I can study related to these 3 content that will make me see or know how the examiner or my lecturer is going to test me on this particular area? You see how it works, right? So from the question, you will now learn that, oh, this is likely what the examiner might likely test. This is likely what the examiner might likely test. And this is likely what the examiner might likely test. Right. But NCLEX use a different approach in the sense that NCLEX question have 3 parts. The body of the question contain the content, right? Which NCLEX have the content. Most students don't even know the NCLEX content. They feel like they are studying content, whereas they are not studying content. You need to know the NCLEX content. The NCLEX content is from the NCLEX test plan. Now, I always used to tell my students this: you can decide to use the NCLEX test plan, or you can decide to ignore it. You decide, because if you don't use the NCLEX test plan, you are going to fail countless times. But if you use the NCLEX test plan, you are going to pass on your very next attempt. The NCLEX test plan, right? The NCLEX, let me write it like this. The NCLEX test plan contain the content that will be tested on the NCLEX exam. I want to ask you this now. This is your lecturer, right? This is your lecturer that is teaching you what? Med-surg. And this is a past student, right? A first class student. This is a first class student who finished your nursing school, right? That you also have as a friend. Now, your lecturer is telling you what will be on our exam. So, your lecturer is telling you, this is what I'm going to set on my exam. And this student who happen to be your friend, first class nursing student, right, is also telling you what this lecturer is going to test on the exam. Who are you going to pay attention to? Are you going to pay attention to your lecturer that is telling you what to be on the exam, or are you going to pay attention to the first class student who is telling you what will be on the exam? Now, guess what? Every student always used to say the lecturer. Now, so if you are going to pay attention to the lecturer, so why is it that now what is happening in uh what is happening right now is that a lot of students only pay attention to question bank. They don't pay attention to the exam writer of the NCLEX. They don't pay attention to the exam writer of the NCLEX. Guess what? Who is writing the NCLEX exam? Is it your question bank program that is writing the NCLEX exam, or the exam writer that is writing the exam? Now, who is writing the NCLEX exam? We call them the NCSBN. These are the writer of the NCLEX exam. So a lot of students ignore these guys that write the NCLEX exam and pay attention to question bank. So let it make sense to me. Are you trying to say your question bank is better than the writer of the NCLEX exam? Now, this is the main reason why a lot of students don't understand the NCLEX, because they jump process. In order to pass the NCLEX exam, you need to follow 3 phases. You need to follow what? 3 phases. The phase of understanding the NCLEX, the phase of planning, and the last phase of studying. Right. Most students don't understand the NCLEX, they don't plan, they just decide to study. Right. You plan is not about having a plan in your question bank. But your question bank might create a plan for you and say, okay, this is how you need to finish up the question bank. No, you need to have a special plan for yourself. You need to understand the NCLEX exam. Most students don't understand the NCLEX. Right. Nursing school and the NCLEX have a different idea entirely. Now, nursing school help you with what? Knowledge. Right? The result of nursing school is what? Knowledge. The result of the NCLEX is license. Now, nursing school give you the nursing school give you the knowledge you need to pass the exam in order to get your license to become what? A nurse. So this is your approach. Right. So now, when nursing school want to give you knowledge, they give you a lot of what? Knowledge related to various courses. So the whole goal of nursing school is for you to do a lot of courses, and at the end of doing all these courses, you gain knowledge related to the field of nursing. But NCLEX, on the other hand, is not trying to what? Teach you knowledge or test your knowledge. NCLEX is not trying to test your knowledge. Instead, NCLEX is trying to test your ability to practice. Right. Let me explain NCLEX and nursing school for you so that you understand. Nursing school is trying to teach you how to count 1, 2, 3, 4 all the way to 10. That is what nursing school is trying to teach you. But NCLEX is trying to test how you can now say 2 plus 2 is equals to 4. 3 plus 1 is equals to 4. Right? You can see. Now, NCLEX is trying to test how you can now say, okay, 1 plus 1 is equals to 2. It's not about knowing the numbers. It's about how you can now think through the addition process, the subtraction process, like more advanced way of thinking related to this. So now in nursing school might ask you question like which number is missing? 1, X, 3, 4, 5. Then you say, okay, 2 is the one that is missing. But NCLEX want to ask you question like, all right, you know your numbers already, and NCLEX is like, okay, 4 plus X equal 20. Then you say, okay, this will be what? 16. So NCLEX want you to critically think. Nursing school just want you to just figure out the knowledge. Right? Because you say, oh, why will I not know this question? It's 2 that is missing because after 1 is 2. That is straightforward. But NCLEX is not straightforward. You can see something like this. That is how the NCLEX works. So NCLEX is trying to see all this knowledge. So yes, beta blocker, right? Beta blocker is used for hypertension. But NCLEX is not going to test. You will never see any question that will test you on what is beta blocker used for. You will never see those kind of questions on the NCLEX exam. Instead, what will you see? NCLEX might just tell you which of the following is contraindicated to beta blocker. And maybe one of your answer might be a patient who have asthma. Then you will not be asking yourself, but initially, I know beta blocker is used for hypertension. So why is asthma the answer? Because beta blocker is contraindicated to asthma. So this advanced way of thinking that shows that you can practice is not about knowing that beta blocker is used for hypertension. It's about knowing how to administer this medication safely. Who should you give it to? Who should you not give it to? Because guess what? A patient can have hypertension and also have asthma at the same time. Are you still going to give them beta blocker? Obviously no. Obviously no. Because it's contraindicated to patients who have asthma. Patients can have hypertension and they can also have heart block. Are you going to give them beta blocker? Obviously no. That's why the patient have hypertension, they have heart block. You cannot give them beta blocker. It's contraindicated. So this is how NCLEX wants you to think. The moment you can understand how NCLEX wants you to think, guess what? You are going to dominate the exam. And this all comes from knowing how the NCLEX writes the question. Right. The moment you can understand the content, how the NCLEX write the question, breaking down the question, creating that understanding for the question, come in place. It become something that it's predictable. Every NCLEX question has become what? Predictable to you. I'm going to show you right now. Now, pay attention to this question. There are 3 parts to every NCLEX question. Remember I said the body, stem, answer key. The body have to contain the content, right? The body contain the content, right? Now, the body of your question that have the content, because as I was trying to explain the difference between nursing school and the NCLEX, I've given you a clue, right, about nursing school, the NCLEX. NCLEX want to test you related to your ability to practice and your ability to show that you are a safe nurse, right? So when nursing school is giving you courses, NCLEX is giving you practice area, right? Those practice area, they are 8 in number, right? It's called the 8 category. Or this is what I like to call it. I like to call it the 8 client needs. Right. Now, instead of NCLEX to give you courses, NCLEX give you the 8 client need, because obviously you are not going to meet courses when you start working as a nurse in the hospital. You are going to meet this 8 client need. There's no point in time that you start working as a nurse and you are going to say, oh, I'm going to the nutrition unit. Is there anything like nutrition unit? Nutrition is a course in nursing school, but you will not find any units like nutrition in the hospital, right? You cannot say you are going to the pharmacology unit. No, there's there's nothing like pharmacology unit. Am I making sense? Right? But everything you have done in nursing school, create a knowledge that make you practice. So what are the practice area you are going to come across when you start working as a nurse? That is what NCLEX puts together and they call the 8 client need, because these are important. If you decide to work as a pediatric nurse, you are going to fulfill this 8 client need. If you decide to work in med-surg unit, you are going to fulfill this 8 client need. If you decide to work in the maternity unit, you are going to fulfill this 8 client need. It's everywhere in nursing. So every one of you will be tested related to this 8 client need. So now you need to understand the 8 client need, because when you understand the 8 client need, you dominate the exam. It's as simple as that. Am I making sense? Now, a lot of students don't even understand this before they go on the NCLEX exam. right? They don't understand this. Now, imagine you using a question bank. Now, pay attention to me. You are using a question bank, right? You are using a question bank. I'm trying to like make sense of what most students are doing. You don't know the content. It's just like, it's just, okay, take for instance, this is me, right? I'm trying to go to a store to get something to buy. Now, guess what? Before I go to the store, right? I want to walk to the store. I'm not taking taxi, nothing. I want to walk to the store. Before I go to the store, to make sure I don't waste my time, I need to start thinking about what I'm going to get what in the store. Am I making sense? So I'm walking, but I have a clear direction. Where am I going to? The store. Now, but if this is me, right? I'm walking, but I'm just walking on a treadmill, right? I'm walking on the treadmill. Now, me walking on the treadmill, I can walk the same distance at which I walk to the store. But guess what? Me walking to the store, I have a direction. But me walking on the treadmill, I don't have a direction. I'm just walking. Now, this is what most students do when they use question bank without knowing the NCLEX content. You are just doing what the question bank is telling you. You don't have a clear direction. Then you come back from taking the NCLEX exam and you are full of complaint. Oh, the question bank did not help me pass the exam. It's you that failed yourself because you fail to understand how the NCLEX work. You understand? You fail to understand how the NCLEX work. The moment you understand how the NCLEX work, no program, right, will make you fail. Instead, you might even find advantage in most program in a sense that, okay, let me just tell you what I know in the past to my 2 years experience. What I've seen is that when students have the ability to understand the NCLEX, they are going to see uh program and they will find out that thousands of their questions don't even make sense. They make sense to nursing school, but they don't make sense to the NCLEX. So it might be a waste of time. Now you are not going to now learn the reason why I don't like using question bank. Instead, I only use what? The NCLEX past question. I only use document from the NCLEX website. That is what I use because that is the best way to learn. Those are free resources that NCLEX is offering you in order to, one, understand the NCLEX, two, understand how the NCLEX writes the question, and be able to break it down. Now, most students complain is that, oh, I've seen the NCLEX test plan, but the problem is I don't know where to read for this content. You can see I have 49 students currently in my program reading those content, right? Remember I said we have 8 client need. Those 8 client need, if you fail the NCLEX exam, you are going to see it. The 8 client need, if you are taking the RN, management of care, safety and infection control, health promotion and maintenance, basic care and comfort, reduction of risk, pharmacology, right? Physiological adaptation, psychosocial integrity. Those are your 8 client need. If you are taking the PN exam, right, you have coordinated care instead of management of care, and for the pharmacology part you have pharmacology, right? For RN it's pharmacology and parenteral therapy, but for PN it's just pharmacology. If you're also taking the REX-PN as well too, this is for Canada, right? It's the same management of care all the way to what? Physiological adaptation. The only difference between NCLEX-PN and RN is that, and REX-PN is that NCLEX-PN RN, they are using what? The new generation NCLEX. But RexPN, there's nothing like case study in it. Right. So it's a case study in your new generation NCLEX. Though the 3 exams are written by the same body, which is the NCSBN, and they still use the same writing style. It's the same writing style. The only difference is that RexPN don't have case study. RexPN have more question than what? The NCLEX question. That is just the difference. The difference between NCLEX-RN and NCLEX-PN is that NCLEX-RN questions are written in the scope of practice of the registered nurse, and NCLEX-PN questions are written in the scope of practice of the PN, right? They still test the same nursing content. There's no difference between PN working in the hospital and RN working in the hospital. They come together to fulfill the same goal. So why do you think NCLEX is going to test a different content for RN, different content for PN? Let it make sense when they are doing the same nursing. The only difference is one can do some kind of care and one cannot do some kind of care. So that's just the difference. If you check your NCLEX test plan. For RN, you have 146 content, and for PN, you have 150 content. Right. So they are similar content. Some content that are here might not be here, and some additional content that are not here might be here as well too. But at the end of the day, it's not about the content. We have 80% plus content that are the same right here, but it's not really about the content. It's about when you are seeing PN question, they are written in form of PN scope of practice, and when you are seeing RN question, it's written in form of the RN scope of practice. So that is just the difference. They still test the same content. Now let me give you an example. It's just like the NCLEX saying you are preparing a plan of care. Now, if NCLEX is saying you are preparing a plan of care, that is how NCLEX writes it for RN. But look at how NCLEX is going to write the same thing. NCLEX is testing the same content. You are preparing a plan of care for clients who have moderate Alzheimer's disease, right? Now, NCLEX can still test this same moderate Alzheimer's disease, right? By still saying it in the scope of practice of the PN. Now, look at it. RN was preparing the plan of care. Now, look at how NCLEX writes it for PN. This is the same format. Most students have taken the PN exam and have failed before. They can testify to this, right? Because I say exact same thing you are going to see on the exam, right? You might be wondering how do I know what? How the NCLEX write the question. Now, the reason why I know how the NCLEX write the question is that the NCLEX writing pattern don't change. What change is the content, right? What changes is the content. So many students, when I tell them you are going to see NCLEX writing question like this, they get shocked. But you should not be shocked because this is how NCLEX write the question. The writing pattern don't change. The content is only what that change, right? NCLEX only have 62 ways of writing the question, and guess what? NCLEX have thousands of questions. But guess what? NCLEX only maintains 62 ways. So guess what? It's the content that is changing, but the writing pattern is not changing. Now, take this down. For PN, right? This is how NCLEX will write it. It will say you are contributing to the plan of care. See RN. RN is you are planning the care, but PN, it become you are contributing because you don't have the ability to plan care according to your scope of practice, but you can contribute. Am I making sense? So these are things you need to know about the NCLEX exam. The moment you start knowing about the NCLEX exam, you are definitely going to dominate it. Right. So NCLEX is about what? Practice and safe. Now, the area of practice, your 8 client need. The 8 client need for RN now give you what? 146 content. For PN, now give you 150 content. But for the safety aspect, now NCLEX will pick up a content and look for how to test it. So right now, NCLEX is picking up a particular content right here, because right here, let me start even giving you the 3 parts to this question. This is the body of this question, this is the stem of this question, and this is what? Your answer keys. Now, from the body of this question, NCLEX is testing a particular content, but NCLEX cannot just test the content right here without not knowing the area of safety that they need to test. So so now your next question is, how will NCLEX determine the area of safety to test? That is where you need to now know the 6 concept. Now, the 6 concept is how NCLEX tests the question. So, to every one of 46 content or every one of 50 content on the NCLEX exam, right? NCLEX tests one of these 6 concepts. So, NCLEX can pick one content and look at the 6 concepts and decide which of these concepts should they test related to this one content. You see how it works? So now this is the reason why when I was building my coaching program, I picked one content and I related that one content to the 6 concept in a way that if you see this one question on the exam, you should be able to answer it because I have trained you on how to answer questions related to this 6 concept. And guess what? NCLEX is going to test you related to this 6 concept. So once NCLEX can test you related to this 6 concept, you have it. You have everything you need to pass. Nothing is holding you back again, because now I understand the NCLEX exam so well. So I've been able to build a process that, despite the fact that I started with I started my first year coaching 52 students, right? That was on Instagram, a small community. But when students said I should come on YouTube, right? A particular video just went viral. Like at that time it was like 1,200 views. So that was viral to me, starting from zero followers, right? So now, guess what? Students were coming in. I was getting like 50 plus message in a day. I want to join your coaching program. I want to join your coaching program. I want to join your coaching program. So that was how I was able to accumulate what? Over 700 students that have helped in passing the exam. Right. So I looked for a process. I said, okay, let me put this into because I was doing it manually before. So I looked for a process. I said, let me put this into a question, into a platform whereby I can just put my question right there and people get access to it and have the ability to pass. All I just need to do is to walk them through the process and they all pass at the end of the day. Right. So that is powerful, and I'm ready to offer this to you at the end of this video. But let us see how we can answer this question. But I'm still trying to explain the NCLEX because I want to make sure that everything is making sense. I want you to pass. I want you to have that ability to pass. I am tired of seeing students failing the NCLEX exam multiple times. It's heartbreaking, right? Having to waste your time more 45 days, whereby within that 45 days, you could have been paid 3 times if you are working as a nurse, right? Not only that, you have to be paying $200 every of the time. To me, I feel money is not even the one that is the problem. To me, I feel money is not the problem because having to wait 45 days after failing, right? After failing for 5 days, when you could have maybe be paid 3 times, right? That is waste of time. That is waste of opportunity, right? Unlike the particular student who I told you failed 14 times, had to pay $200 every time she failed. Now she paid what? This amount. But just one time payment of $497 for my coaching program for 60 days made her pass on her 15 attempts. Right. So a little investment that you can invest right now can give you a career worth 70K US dollars in a month. So think about it. So it's not about your situation right now. Think about the transformation that you can get from turning your situation around. That is how I think about it. So the moment you understand about the NCLEX, you are definitely going to pass. The one thing that is holding you back is these 3 things. You don't know the content, you don't know how the NCLEX write the question, you don't know how to understand it. I'm telling you, if I break this question right now, most students will not be able to think the same way I am thinking. Back then in nursing school, I had no tutor. I was learning things myself. But right now you have access to me. I can easily help you, walk you through every day to help you pass for 60 days. Right, that is powerful. Because if you tend to do most things by yourself, you get overwhelmed. But if you have somebody that walk you through the process, you are not even going to see the stress in it. I'm telling you the truth. Right. I wish I had someone like me to teach me about the exam. But I had to use 9 months in order to figure out this process right now that I'm teaching you in just a short video. Right, I can break down 3 years of nursing knowledge in just this one whiteboard right here. And then you'll be like, wow, so this is just nursing that I've been struggling with for the past 3 years. Nursing is not difficult. You just need somebody to give you the the foundation so that you can create the bigger picture. The moment you can understand where everything is coming from, you start to create understanding. That is how it works. You understand? That is how it works. So now let's break down this question. This is the body of the question, right? Clearly, we can see that this question is testing you on what? Medication. This one is what? Your answer keys. Clearly, you can see it's testing your medication, but you need to understand the approach at which the NCLEX is testing you on a certain medication. Now, look at what the question is saying. It said the nurse is caring for a client who is receiving high dose of so medication, right? Now, guess what? That is just the body. The body gives you the information. So the NCLEX is testing you related to the medication. It's not saying anything. It just said, you, the nurse, you are caring for a client who is receiving this medication. So now when you are caring for a client who is receiving medication, what is coming to your head, right? Because they are receiving the medication constantly. It's not that you are trying to administer the medication. They are already receiving the medication. So now you're thinking when a patient is receiving medication is related to what? Evaluation. So now I automatically believe that when the examiner want to test me, the examiner will be testing me related to evaluation. You understand? Because if I'm caring for a client that is receiving medication, I need to evaluate anytime. Let me tell you something. Anytime in nursing, NCLEX tell you a patient have a certain condition and NCLEX introduce a certain intervention, right? It means that the condition is already under control because an intervention is already done related to that condition, your next step of action is what? Evaluation. That is the reason why one part of the 6 concept is related to nursing process, because that's one part of the 6 concept, right? Nursing process. So one aspect of nursing process is evaluation. And if you take a look at what the examiner is testing here, he said when evaluating the client for life-threatening syndrome related to the medication, it will be priority for the nurse to report. It means that the nursing process part that the NCLEX is trying to test is what? Evaluation. And you can even see it right here. It's written clearly. So why is the NCLEX exam difficult to you? Most of the time, you think about the medication, it gets you lost from what the examiner is testing. You cannot even break the answers. But if you pay attention to a certain pattern, in which if you apply the same pattern to thousands of the same question, despite the fact that this medication is changing, you have the ability to still answer the question regardless of the medication. Now, let me show you my simple magic. So no, NCLEX is not difficult. Now, I'm going to clean off or take off the medication. Now, let me take off the medication. Let us act like we don't even know the medication exists, right? I bet most people don't even remember the medication now. I just hope. Now, let's forget about the medication for a while and let's answer this question. You will see how we answer this question even without not knowing the medication. This is why I said earlier on, I want to make you a dangerous test taker. Yes, a test taker that the NCLEX is going to be scared of in a way whereby when you take the exam, NCLEX will have no choice than to stop your exam in 85 questions. Yes. Now look at it. I don't know the medication, but I know what the examiner is testing. Now, the moment I'm seeing statements like this, the nurse is caring for a client receiving so. Remember, I want you to think like the NCLEX. I want you to think like a nurse. I don't want you to think like a student. So let us think like a nurse. Now, when a nurse is caring for a client receiving something, what do we do? Is it not to evaluate? Yes, it's to evaluate. So guess what? The examiner cannot test me on anything else than evaluation. So the question is straightforward. If you are still struggling to figure out this question, it means that you don't know the nursing role. When a patient is receiving something, be it a procedure or they return back from a procedure, they are receiving medication, they are receiving treatment, the next action is to evaluate. Let that ring in your head. So I'm expecting the examiner to test me related to evaluation. Even if the examiner is not even stating evaluating, right? I know that what the examiner will test me is evaluation. It makes sense that way because that is nursing principle. It can never change for nothing. It's nursing principle. The moment a patient is receiving something, the next thing is evaluation. But now, the examiner, there's different evaluation you can do to different things, but you need to pay attention to what the examiner is asking you to evaluate. There are 2 ways to know what the examiner is asking you to evaluate. One, you can pay attention to the STEM to know, or you can pay attention to the answer key. Sometimes the STEM might not be that clear, but the answer key can help you out to understand. Right. And that's what I call reverse engineering the question in a way whereby you don't start by reading the question or you don't start by reading the body and the question. Instead, you start by going through what the answer keys, understanding what the examiner is thinking, because the thinking process of the examiner all come from the answer keys. When you understand your answer key, you can understand what the examiner is thinking. It's just like right now. Let me tell you something. It's just like right now. This is my 2 hands, right? This is my 2 hand. I'm just trying to draw something. Now, I kept something here, I kept something here. I closed my hand tight and I ask you, what did I place in my 2 hand? Right? You don't know because you don't have an idea. There are 1,000 things you can think about. You don't have an idea. But what if you can ask me for hint and I tell you, okay, one is a coin and one is a key, and I tell you, okay, I place coin in one part of man and I place key in another part of man, so figure it out. Now, out of 1,000 things you can be thinking in the word, you only can start what? Figuring out where I put the coin and where I put the key. Now, so guess what? If you don't have your answer keys in your question and this is your what are they calling it? The examiner question. Guess what? You'll be thinking about 1,000 things. Now, look at what the examiner is saying. The examiner is saying when evaluating, let me remove this. When evaluating the client for life-threatening syndrome related to the medication, it will be priority for the nurse to report. So if you don't have these answer keys right here, guess what? You will be thinking about 1,000 life-threatening syndrome. I'm just trying to exaggerate, right? There might not be 1,000 life-threatening syndrome. There might just be, in the word, right? But I'm just trying to exaggerate. You might be thinking about many life-threatening syndrome. But when the examiner give you just these 4 syndrome, then you don't need to be thinking about 1,000 of syndrome again. You just need to focus your thinking on what? These 4 syndrome. Am I making sense? So now, when you focus your thinking on this 4 syndrome, you have the ability to now select the answer successfully. Now, what you now need to now do is now, okay, the examiner said this, said this, said this, said this. Now you can think through what the examiner is saying. Oh, now I told you coin is in one part of my hand, key is in one part of my hand. Now you might not start saying if coin is in one hand, there's likelihood that this is how we hold it. But if key is in one hand, key is much bigger, maybe there's a way that there will be slacking in the way it's going to hold it. So with that mindset, I can look at the tightness of the hand and decide whether coin is there or key. Does not mean I'm going to be right, but at the end of the day, I have an ability to start thinking through how you kept either the coin or the key in your hand. Same way, I have the ability to start thinking, why is the examiner having this answer? 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 Am I making sense? Now, look at it. The examiner is testing you for life-threatening syndrome related to what? What we have here, a medication. I don't care about what that medication is all about. I don't even want to know what that medication is all about. But the fact that NCLEX is testing me related to what? Life-threatening syndrome. One, you need to understand what is life-threatening syndrome related to medication. Not this medication, but related to medication in general. Life-threatening syndrome is also known as adverse effect. So life-threatening syndrome is also known as adverse effect. Now, it means that the examiner, because when I went through this answer key, I can easily tell that the examiner is trying to test my knowledge related to side effect and adverse effect. So meaning 3 answers here are side effect and just 1 answer is adverse effect. Am I making sense? Now, all I now need to figure out is which of them are side effect and which of them are adverse effect. Now, let me educate you a bit about side effect and adverse effect. Now, side effects is what you report to the doctor. Sorry, oh my goodness. I'm so sorry. Adverse effect is what you report to the doctor. Side effect, you don't report it to the doctor. They are expected. They can cause discomfort to the client, but you don't report it to the doctor. You report adverse effect. And look at what the examiner is saying. It will be priority for the nurse to report because you only report adverse effect. You only teach patient about side effect so that when they start experiencing the side effect, they don't feel like, oh, something dangerous is happening to them. Am I making sense? So that's why you want to teach patient about side effect because if a patient is having maybe nausea after taking medication, that's a side effect. You just need to tell the patient this medication might cause you to feel wanting you to feel like what? Vomiting. Right. So when they start feeling that kind of way, they will not feel like, oh, there's a problem. Right? They will understand that it's the medication. But if I tell the patient, oh, this medication can cause your blood pressure to be very low, so you need to monitor your blood pressure. Right? And this medication can cause cause you to be dizzy. Right? So if it's causing your blood pressure to be low, that's an adverse effect. Extremely low, that's an adverse effect. And when you check your blood pressure and it is less than expected, report to the doctor. But if you are feeling dizzy, that's a side effect, is expected. Now, when the patient feel dizzy, they will understand, they will take necessary precaution in handling that. Now, but when the patient check their blood pressure and then their blood pressure is low, they will know they need to report to the doctor immediately. You understand? So that is the difference between side effect and adverse effect. And that is how you look at this question because the NCLEX is trying to test your ability to understand what? Side effect and adverse effect. Now, if you know this medication, you can easily answer it. But guess what? There are a lot of students that will go on the NCLEX exam. So medication, they are not going to know it. So now let's give privilege to those students to have the ability to answer any question. Because the moment you can understand pharmacology, you are able to answer the question. Pharmacology is not mainly on the medication. Pharmacology is what those medications do to one key thing, which is the 10 body system. Because when you are giving any medication, right, it affects a certain body system. Now, so if there's a way you can use your answer key to understand the body system at which this medication is affecting, you can easily think through what the medication is all about, what the examiner is testing. You understand? Now, this is how I help students to pass pharmacology. Now, let me tell you the real secret. Now, pharmacology, when you give a certain medication, you need to know what are things we do before giving medication and what are things we do after giving medication. Now, the moment you can know what are things we do before giving medication and what are things we do after giving medication, you don't need to even know too much medication again. You just need to start looking for those things in your answer key. Right. It's just like right now, if NCLEX puts beta blocker right here, and NCLEX is saying monitor for the patient's pulse before administration. Right. Now, I have learned that there are some medication that we check for the pulse before giving medication. Right. Now, if I see answers like this on my question, then I will start thinking about, is this medication related to a medication that we monitor for the pulse? That is what I will be thinking of. So even when I don't know beta blocker and I'm seeing this, I can easily interpret this answer, because beta blocker is not the only medication that drop down the pulse. Hope you know, right? We have other medication as well too that can drop down the pulse. So now I will just be trying to think about it, and I'll be asking myself, is this medication related to those medication that drop the pulse? You understand? But at the end of the day, before I can easily say this is my answer, I need to go through every other answer key to make sure that every other answer key are wrong before I'm not going to now say, oh, because all these are wrong, now this is the only answer that makes sense. And definitely, even if I don't know beta blocker, I just need to accept that that is the answer. So you automatically what? Become answer. You can see how smart that is. Now, let's use that same smartness in this same question as well too. Now, guess what? I don't know this medication, right? I don't know this medication. I'm acting like I don't know this medication, but I understand what evaluation is, because I know, because if you don't know the medication, please at least know how to think like a nurse, because you cannot end up not knowing the medication and also not knowing how to think like the nurse. And guess what? Once you join my coaching program, even if you don't know how to think like a nurse or you don't know medication, you are going to learn all this in my coaching program. So yeah, I got you. Right. So now, but learn it now. When the nurse is caring for a client receiving so and so, the nurse is going to do evaluation. So guess what? The examiner is even telling us examination. That's a good green light right there. And NCLEX is talking about life-threatening syndrome. So instead of the NCLEX to tell us to evaluate at random, instead NCLEX is testing us on a specific evaluation, which is life-threatening syndrome. Now, life-threatening syndrome can be related to disease condition. It can be related to treatment, right? It can be related to procedure, intervention. But guess what? At the end of the day, even if I don't know this, but I know for the NCLEX saying I dose, it means that the NCLEX is testing me related to what? Medication. So my life-threatening syndrome related to medication will be what? Because the only time you think about life-threatening syndrome is when you are being tested on side effects versus adverse effect. So I know NCLEX is testing me on adverse effect. So evaluating adverse effect. So one of these answers is related to adverse effect. So related to the medication, it will be priority for the nurse to report. So now when the NCLEX is saying we should report, we don't report side effect, we report adverse effect. So now I'm going to ask myself, and now let me tell you something. Adverse effect is something that can kill a patient, right? It might not be immediately, but it might kill the patient, but there are side effects that will never kill the patient. Like now, take for instance, a patient have dry mouth. Now, let it make sense. If you have dry mouth, can you die from dry mouth? Can you die from dry mouth? Obviously, no. Right. Can you die from photophobia? Obviously, no. So these are side effects, these are side effects. Can you die from orthostatic hypotension? Obviously, no. Now, the problem is this. One student asked me a brilliant question in my coaching program. She was like, oh, but I thought hypotension is It's dangerous. That's why I selected 2, because she selected 2 as answer. Now, let me teach you something. There's difference between orthostatic hypotension and hypotension. The difference between orthostatic hypotension is that this will reduce the blood pressure, but in few minutes the blood pressure will get back to normal. Right? That is orthostatic hypotension. But hypotension on its own, right, once the blood pressure is low, the blood pressure will never get back to normal. You need intervention to make this blood pressure get back to normal. But when it's orthostatic hypotension, the blood pressure by itself get back to normal. So this is not life threatening. This is just like a side effect to what? Medication. Right? So this is not life threatening. The only life threatening problem right here we have is theory, which is fever. Now ask yourself this one question: how on earth will you give a patient medication, and when we are expecting the medication to solve a certain problem, instead of the medication to solve a problem, instead it is giving us a complication, it's giving us fever instead? So does that make sense to you? It means that medication is causing what? A complication. Now, this medication is a psych medication, and if you know about this medication, or you know psych medication, you'll find out that there are some psych medication that can cause your WBC to be low. And when your WBC is low, it exposes you to infection, because now your WBC is low, you don't have your immune system working perfectly to help you fight infection. So infection can now come in easily. Right. So there are 2 things that can be related to this medication, or psych medication. Is either the NCLEX is telling you the WBC is low. Maybe instead of the NCLEX putting fever, NCLEX is just putting low WBC. Right? Then low WBC will still be the answer. But now NCLEX is putting fever. It means that previously this client WBC was low, but all of a sudden they started developing fever because they got exposed to a certain infection, then they have fever. So at that point, you might not be able to at that point it's a problem, right? Both low WBC and fever, they are a big problem, right? So but when they have fever, definitely their WBC will be high, because how do you know if they have infection? Is when you have what? Increased WBC. And by the way, do you know your white blood cell count? Right, it should be what? Between 5,000 to 10,000. Note that for the NCLEX, right? NCLEX is going to give you all this. NCLEX will not give you normal range for vital sign. So don't expect normal range for vital sign. NCLEX will never give you that, because NCLEX believe that that is the foundation of nursing that you need to know by yourself perfectly. That's what makes you a nurse. But labs, you see labs, any other thing, NCLEX is definitely going to give you the normal range, right? So that's what you need to know. So now, have I helped you out in understanding the NCLEX exam? If I have helped you out, trust me, I want you to listen, right? If this mini tutorial just taught you more than what you could have learned in a full week of self-studying, imagine what happened when I coached you for 60 straight days. You see, now my NCLEX coaching program is designed to retrain your brain to think the way the NCLEX expects. Not like a student trying to memorize facts, but like a nurse making safe, fast, clinical decision. Now, this is what you are going to learn in my coaching program, right? I will teach you how to break down NCLEX question on prioritization. A lot of students struggle with prioritization. Go and ask students that have taken the NCLEX exam before. They will tell you they had prioritization question. It's on the exam. This is one area NCLEX wants you to show that you are a safe nurse. It's the biggest aspect of nursing care. That is the reason why every student gets question related to prioritization. You cannot escape it. Right. So take advantage of this coaching program that will allow you to answer every prioritization question correctly on the exam. That way, you are building yourself with more points above the passing standard. It will take you to miss a lot of questions to drop below the passing standard and fail the NCLEX. This is why my students end up passing the NCLEX exam successfully in 85 questions. Right. Med-surg as well too. Most students are going to see a lot of disease condition. They want to know how NCLEX tests this. I'm going to show you how NCLEX tests it. Pharmacology as well too. Pharmacology after management of care. Management of care is 16% of the exam. Coordinated care is 21% of the exam. Pharmacology is 16%. Did I say management of care is 16%? Management of care is 18% of the exam. Coordinated care is 21%. Pharmacology is 16%. Related to RN, right? Because pharmacology is NCLEX is very big on pharmacology when it comes to RN exam. Go and ask a lot of students. Students will tell you, oh, I saw maternity. Right. A particular student who failed the NCLEX exam was like, oh, there was a lot of maternity question on my exam and I never studied for it. Now you have the access to study that in my coaching program. Pediatrics as well too. Case study. This is very important as well too, because NCLEX created this new generation NCLEX just to test you on this case study most especially. So it's NCLEX pay attention to how you perform with case study. Right. So case study is very important. I will teach you how to answer case study question even when you don't know the disease condition, because most students try to study case study 1,000 of case study question because they want to pay attention to learning what 1,000 of disease conditions, so that when they go on the NCLEX exam, they will get one of those disease condition and they will be able to answer the case study. You don't need that. You just need to be able to think like a nurse. Your answers are on the case study already. You just need to brilliantly think through the question, think through the whole case study structure and be able to answer it. The only thing you need is to understand the 6 step. Right. How do you recognize clue? How do you analyze the clue? How do you prioritize hypothesis? What kind of solution are you trying to generate? Let me tell you, you don't need the diagnosis, because when you get to generating solution, NCLEX is going to give you the diagnosis. Now, if you are trying to think about the diagnosis, then you are not thinking within your scope of practice, because your scope of practice is for you to think as a nurse, not like the doctor. So what do you need the diagnosis for? You are the first contact with every client. So at the point at which a client is admitted, are you going to be asking them? Are you going to be asking them for diagnosis? No, you start with assessment, because you need to create your nursing diagnosis that leads to the bigger picture, which is the medical diagnosis. Some patients can come to the unit without no diagnosis. So why are you trying to diagnose patients on case study? That is wrong. That is doing the doctor's duty, because I know most of them are trying to make question and answer question in a way that is not difficult. They feel like if they can know the diagnosis, they can easily answer the question, but that is not true. The moment you can still answer your question when you understand the right way of going through it, and that's what I'm going to teach you in my coaching program. Right, BOTA as well too. Right, BOTA is not even difficult. BOTA, I prefer to have 85 BOTA question on my NCLEX exam. I'm going to pass the exam in less than 1 hour. Right, because both I know how to go about it. Both the int are always in the question. Right, but a lot of students don't know this. Now I'm also going to help you with chat question. Right, so yes, a particular student, when I saw a test report, I saw she did well in her case study. Right, so if you have the ability to do well in your case study, this is what I told her. You will also have that same ability to do well on both and chat, because both chat case study is a bigger aspect of both and as well to chat. So let me give this to you. Now, a lot of students tend to be between two answers. I've seen this a lot, right? Now, but the reason why you are between two answers is because it's always these 3 things, like I said: content, not knowing how the NCLEX write the question, and understanding it. Now, the moment I can help you, right, eliminate trap answers, you will never feel two choices feel right to you, or you will never be between two answers. Now, another thing a lot of students struggle with is that they feel like every NCLEX answers are the same. Right, every NCLEX answers are the same, or maybe they feel like they are correct. I mean, right, they feel like every NCLEX answers are correct, so they are lost within it. Now, I'm going to help you out to figure it out, because now every NCLEX answer are not correct. The problem is that you don't understand the question. That is the reason why you feel like every answer is correct. The moment you understand the question, understand how NCLEX writes each answer keys. We did not even talk about how NCLEX write the answer key, but I'm definitely going to teach you how NCLEX write the answer keys in my course program. The moment you can know how NCLEX write the answer keys, trust me, you are going to pass the exam. Right, you are going to pass the exam, because that way you can easily break the answer keys. Right, because I understand the answer key, that's the main reason why I was able to create this strategy called reverse engineer the question. So I just need to look at the answer first, and then before I go to the question, I easily know what the examiner is testing. Right, you will also have the ability to recognize disease condition by decoding the answer choice. Now, let me tell you something. A lot of students will go on the NCLEX exam. I've heard this a lot. They will say, oh, I saw some disease condition I have never heard in my life. Right? Some people will say, oh, I read about this disease condition, but I forgot about it. Now, this will never be a problem after finishing my 60 straight days with you. Right? Because I will give you the ability to look at the answer key and instantly remember what you forgot, or look at the answer key and easily know what that disease condition is all about. NCLEX is not difficult. You just need to know how 1% of students are passing the exam in 85 questions. And to be part of that 1% of students, this is what you need. I'm going to help you to build your confidence so strong that every question starts to feel predictable, not overwhelming. Now, when students see their first question, they are overwhelmed. They're like, wow, how am I going to answer this question? They see the second question, they are so overwhelmed again. And then they see the third question, they feel like giving up. Right. Most especially when students get to 85 questions and they feel like the exam should stop in 85 questions. They have this, they now see 86 questions, they feel tired, they feel disappointed, they feel lost. Right. But the missing thing is that you are not confident in yourself. The moment your exam did not stop in 85 questions and you are getting 86 questions, it means that you are doing so well. The NCLEX just wants you to answer more questions to show that you are a safe nurse. That is just what it's saying. So keep showing the NCLEX exam that you are a safe nurse. If your exam have not stopped you, then you are doing great. You are doing great. So that should be your thinking moving forward, right? Now, the best part of everything that I'm trying to tell you is that this system is going to help you what? Pass the NCLEX in 60 days or less. Even if you have failed before, even if you are experiencing what? Burnout, right? Even if you have studied for months, because most of them will say, okay, I want to join your coaching program. Like last week, like I have like 17 students who joined my coaching program, and they were like, I've studied for a long period of time now. Can you help me? A particular student told me 2 years he did not study, 3 years, right? That's max I've seen last week, right? Some people say it's been months. I finished my nursing school 6 months ago, you know. So these are complaints. So if you fall in this particular category, trust me, you are still going to pass, right? In 60 days or less. Now, here's how we do it. In the first 30 days, you are going to learn the content. This is how I do it. I break my coaching into 3 parts, right? That is the first 30 days, right? 15 days, and then the last one 15 days. So the first one is content. Now you're going to learn content. Next we are going to do question, and last we are going to do what? Strategy. Now when we are doing the question, right, I want you to hit 60 to 90% accuracy. The moment you can hit this, I believe you can use content to answer NCLEX question. Now but the last part, I will teach you strategy, right? The same strategy I taught my students who fail the NCLEX exam 14 times. Right? I'm not going to hold anything back. I will give you everything, right? So that the NCLEX can fear you. Because my whole goal is this: I want to make you become the kind of test taker the NCLEX fear, right? So that you prepare in a way that the exam have no choice than to shut off your exam at it at 85 questions, and it all come from this. But guess what? This is what you need to do, because this is the biggest part. Once you know the content, strategy start making sense. Now when I give you the last readiness assessment, right, I want you to meet up 75 to 90% pass. Now, if you meet up 75 to 90% pass, I can 100% guarantee you that you are ready to pass the NCLEX exam in 85 questions. Right. So this is how it is. Right. So you will take your NCLEX and it will feel like another practice test. This is what I want the exam to look like for you. Right. So you don't need another textbook. You need a strategy. And I have built everything you need for you. So I want you to join my full NCLEX coaching program today just for $497. Or you can even get started with payment plan by putting a down payment of $250 and let me know when you are going to pay the rest. That is it. No stress, no excuses. Right now you have two choices. You can keep guessing, cramming, and hoping you pass, or you can join the program, follow the plan, and finally become a licensed nurse. The future, your future self already know what you want, right? Your future self already know what to do. So right now I want you to text me +7 67 613 0769, and let's pass this thing together. All right.